Should we talk about, I think, something that it was a tee up for us, I think, that is, I know, near and dear to your heart personally, as well as one of the priorities of Guidewell and Florida Blue, this opioid epidemic. First of all, you might want to describe for everyone what Guidewell is in Florida Blue, and then a little bit of context about how seriously you're taking this topic.
Sure, be glad to do that. So Guidewell is the holding company for Florida Blue, Blue Cross Blue Shield of Florida. We are a not-for-profit mutual organization, and so we take it very seriously around what we're doing for our members. We have about $5.5 million members in Florida, and making sure that we're very entrenched in the community and working through community issues. Not directly my area of responsibility, because I am more around corporate development, strategic partnerships, and so forth, but definitely a mission of the company overall, and making sure that we're doing things we need to do to address this issue.
So what, in Florida, obviously, that's your first priority. What are you doing? What is the organization doing around focusing on the opioid epidemic, and more directly, I want to kind of draw. I want to draw focus on the last 12 to 18 months.
Sure. Well, when you look at the statistics, we have a huge issue in Florida. In 2017, I think there was 13 million opioid prescriptions issued. We only have 20 million people in the state of Florida.
So give those stats again. 20 million people.
Right, and 13 million prescriptions issued in a one-year period. So it is a huge issue. We also have a very high level of overdose deaths occurring in Florida, above the national average. And so obviously not a place that we want to be. It's a huge issue for the state and the communities of Florida. So there are a number of things that we are working on there. First and foremost, we got out in front of this and made some medical policy changes, and making sure that we were making formulary changes to remove some of the drugs of the greatest issues. There's good replacement drugs out there that are valuable and provide the right level of efficacy and so forth. We also working with our physicians and making sure that we have the right auths in place and so forth, to make sure they're prescribed accordingly where they should be as well. So that's one area, and that was a quick action that we took immediately to address this. Another area is around innovation. So we have, for those of you that don't know us, we have an innovation center in Lake Nona and Orlando market area. And
beautiful innovation center.
It is beautiful. Yeah. For those of you that may know Tamara St. Clair, she's known in the community. She's head of our strategy and innovation team. And they have a number of thematic areas that we work through on a regular basis with the community, and opioid crisis is one of those. And so we convened in October a number of constituents through the whole ecosystem of opioids. First responders, caregivers, physicians, behavioral health clinicians, you name it. Everybody that touches this issue was brought to the table to talk about what we could do in the state of Florida. And, it's a complex issue. It's not one that's going to be solved overnight, but there are ways we believe, to apply innovation in this space around digital engagement and so forth, and getting folks to take more accountability around their health condition and in general. So, there will be things that will continue to come out of that, and working with those constituents to drive innovation in the marketplace. A third area that I would speak to is we have an investment actually in a company called New Directions, which is a behavioral health management company. And so we've been working with them to apply innovation in this space as well. They just announced a partnership with 2 hospital systems, one in Northeast Florida, which is one of our highest impacted areas, over 1,000% increase in overdose deaths in that area, as well as down in the Hollywood, Florida area. So Memorial Hospital and another hospital system up in the north part of the state are partnering with us so that we can start programs at the point of the first emergency room visit and trying to get out and ahead of this. Typically when someone comes in, they're treated for the symptoms, not the use disorder. And so we're trying to put peer counselors in place that work with the individual right out of the gate, trying to help educate them on medication-assisted therapy and helping them with their decision-making process around the course of action. And what we're finding by starting at the front end of that first episode in the ER is that we're having, and it's still very early on, but the statistics are good, of reducing repeat occurrences by 68%.
Well, first met Pat Garrity, your CEO, a few years ago, and I was always struck by the commitment to innovation and working with startups from the very top of the organization all the way through the leadership, all the way through all the people that we've interacted with. One of the reasons we were so excited when you became an official partner last year was this authentic commitment, like you're describing, to believing that entrepreneurs and startups are a part of the solution, and it's not going to be solved inside the four walls of your organization.
Definitely.
Can we go deeper into that commitment? Because I think, again, it's one thing for a CEO to say it, he's been espousing it for several years now, but you're doing it, you just described one. For the entrepreneurs out there, for our urgent call to action today, this moonshot to end addiction and the opioid epidemic, what have you learned that needs to be screamed louder to the community around the world about how important it is and how open you are to working with them?
Yeah, well, like I said, it's a complex issue, and we can't solve it by ourselves, and we are going to have to solve it in collaboration with partners. As I gave an example of one. I think there's many, many other things that could be done out there. As we look at the healthcare system, we can continue to beat up with some of our constituents in the healthcare system around price, but that's not really going to even fix the system overall, let alone this issue. And we need to really work more collaboratively with our health system partners, with entrepreneurs out in the community, looking at ways that we can tackle this. We are, very focused on innovation, trying to bring innovation that's out in the marketplace and partner that with our company to drive better outcomes overall.
Fantastic. So I have to ask you, you were watching Sanjay from the side.
Yes.
What'd you learn over his talk that perhaps either you didn't know or that continues to surprise you?
Obviously he has deep experience in this space and a clinician and so forth. And what I learned is that there's a number of ways to treat this. I mean, he talked about, different solutions outside of, replacement drugs, outside of medication-assisted therapy. And I think as a community and an industry, we need to explore all of those.
Yeah, and do it some more. Well, I want to thank you not only for joining us today, but really the partnership. And over the last year, gotten to know you and your team, and recognizing that Pat is incredibly serious about his commitment.
He is.
This commitment is real. I think that we're being able to now point to some real great models of big organizations that have, significant populations under care that are working with entrepreneurs and startups to make a difference. So on behalf of all the entrepreneurs that have had a chance to get to know you, and I know you're going to meet a lot more, thank you, and thank you for being a great partner, and thank you for joining us today.
Sure. Thank you.